Good evening, I'm Rory Fitzgerald, Professor of Practice of Survey Research at City University of London. And good evening and welcome to all of you to our first European Social Survey, City University of London and NatCen Social Research, a Methods seminar series of 2021. Delighted this evening to welcome Dr. Jonathan Burton from University of Essex and ISA to talk about the work of the flagship UK Understanding Society longitudinal survey and how they've responded to the pandemic. And we've heard previously in our seminar series about how other surveys have responded. It will be really interesting to see how the large-scale household survey in the UK has responded. So we're delighted to welcome John. He's the Associate Director for Surveys, Understanding Society, and based at the Institute for Social and Economic Research at the University of Essex. And he's responsible for the data collection across the survey, and he's written extensively on survey methods research, particularly around data linkage and the use of new technologies. If you'd like to pose some questions to John, please use the chat facility or the question and answer, ideally the question and answer, but if not the chat, and we'll ask John some questions at the end. The lecture is being recorded and we will make the slides available afterwards, so no need to take pictures, etc. That will all be available in a couple of days. So without further ado, I'll hand over to John for the seminar. Thank you, John.
Thank you very much, Rory. So I've been asked to talk about the response of Understanding Society to the COVID-19 pandemic. And whilst it's me here presenting, there's a lot more people involved, a lot of people at the team working, both at ISA, working on the questionnaire, the fieldwork design, the whole data processing and deposit process, but also there's a research team that led what we call the event-triggered data collection, and more about that later, within Essex and Michigan, and Tom Crossley at the European University Institute, and Brendan Reid, who was at Essex but is now on Facebook. Also, we really want to acknowledge the large team of people who have been working on this at the fieldwork agencies. So Kantar and NatCen Social Research have been working on Understanding Society, the main stage, and the innovation panel. They've also, Kantar worked on the COVID-19 telephone survey and youth self-completion, which I'll talk about in a bit. Ipsos Mori have worked on our COVID-19 web surveys and the youth strength and difficulties questionnaire. And then we've been funded for the data collection by Economic and Social Research Council and the Health Foundation. This has been a huge amount of work, particularly over the last year or so. The funding did cover the data collection, but it didn't really cover anyone's time. So this has all been things that we've sort of had to do in amongst our day job. So it's put a lot of pressure on a lot of people, and we're very grateful for all of their work. So I'll just talk a little bit briefly first about Understanding Society, in case you don't know about it. It is the UK Household Longitudinal Study, UKHLS. It's representative of the UK population. Understanding Society itself began in 2009, but it also incorporates the British Household Panel Survey sample. This started in 1991 and was an annual survey as well. So for our BHPS sample members, we'll be going back this year for the 30th year of interviews. At Wave 10, which was around 2018, 2019, finished mid-year last year, but we had about 20,000 responding households. We issued about 24,000 because we have people who drop in and drop out of the study. Understanding Society, as well as having the representative of the UK population sample, it also includes an ethnic minority boost and an immigrant boost sample. These came in at Wave 1 and Wave 6 to try and keep the survey and the sample representative of the UK population. And I'll mention it very briefly later in the talk, but it won't be a focus, but we do have an innovation panel of around 1,500 households, which has been invaluable for experimental methods testing. So with Understanding Society, we have annual interviews with the same people over time. So all members of the original households, when they were drawn in 1991 or 2009, are original sample members, and them and their descendants form the core sample, and we follow them every year as long as they're living in the UK. So if they move house within the UK, we follow them to their new address, we try and interview them there. And we also interview other people who are living with them. At the moment, it says there that we follow them as long as they're living in the UK. One thing that we're piloting at the moment is actually an immigrant survey. So even leaving the UK might not be enough to get out of Understanding Society. We're going to try and follow them and just ask a very brief set of questions whilst they're abroad. The annual interview cycle starts off with an enumeration of who's in the household. There's a household questionnaire of about 15 minutes. And then we have individual interviews of everyone in the household, age 16 and above. We also ask 10 to 15-year-olds to do a youth self-completion questionnaire, which is on paper at the moment. But we do collect information about everyone in the household. So we collect basic information about all household members. We also collect information about 0 to 9-year-olds from the parent or the guardian. So there's information about births, birth weight, things like that. And we have some child development questions when the child is 3, 5, and 8, which we collect from the parent or the guardian. So it's a whole household survey. Fieldwork can sort of be a bit complicated. The fieldwork is spread over 2 years. So we issue the sample in 8 quarterly subsamples, and each quarter is nationally representative, and each sample month is in the field for 5.5 months. So this does mean that there's a long gap between when we're actually planning the survey and when we can release the data. So as an example, we started planning the content for wave 10 in late 2016. We then developed the questionnaire, we sort of specified it, we had a consultation exercise with government co-funders, we scripted and tested the questionnaire in 2017. Fieldwork then started in January 2018 and ended sort of mid-May in 2020, and the data was deposited and was available in late 2020. So there's a 4-year gap between when we're actually planning the content of the survey and when the data is available for users. And our fieldwork partners on Understanding Society are Kantar and NatCen Social Research, and they've been working on it since wave 9. So we have this long production cycle. As I said, each wave is issued over 2 years, but it's an annual interview. That means we have these overlapping waves. So at the moment, early 2021, we have the end of wave 11 in the field until May. We have the second year of wave 12 and the first year of wave 13. Because we have this long sort of production cycle, it really limits the feasibility of changing content mid-wave. Because if we do change, if we add some questions in halfway through a wave, that means for all of those people who've been interviewed up to that point, we won't have that information. So we have to have this balance of keeping questions consistent within the wave and trying to deal with any unforeseen circumstances. So speaking of which, COVID-19, in mid-March 2020, we suspended face-to-face interviewing after discussions with Kantar and NatCen. And at that time, we had 3 waves in the field. So it was, almost a year ago. So we had wave 10, wave 11, and wave 12 all in the field. But one advantage we had for Understanding Society was that we already used a mixed mode data collection. So for the first 6 waves of Understanding Society, it was just face-to-face, really. At wave 3, we did add a small telephone mop-up towards the very end of fieldwork period to get people who we weren't able to contact in person. On wave 7, we started introducing the web, and we invited adults who had not taken part the previous year to complete online first. So everyone who was in a household that had taken part at wave 6, they were still face-to-face. But those where they hadn't taken part in wave 6, at wave 7, we invited them to take part online. And then we followed up non-respondents face-to-face. And then, of course, there was the telephone mop-up. And from wave 8 onwards, we really sort of started moving into web first. So we invited more and more of the sample to take part online first. And then after the first 4 or 5 weeks, non-respondents were issued to interviewers who would then try and contact them in person to do a CAPI interview. And then at the end of their fieldwork period, again, was a telephone mop-up. And then we had a group of the sample that was face-to-face. So we had 20% of the sample, which we had ring-fenced as being face-to-face. And so this was really so we could carry on testing the effects of a mixed mode design. So 20% of the sample we issued face-to-face first. And then we also issued what we call low propensity web households. So using our innovation panel, we had modeled the likelihood of people and households taking part online. And we just used that model on our main stage, and those households who were the least likely to take part online, we issued them face-to-face. So wave 11, wave 12, we were issuing about 70% of the sample web first, and 30% were face-to-face. And those who were issued face-to-face, if they didn't take part in the first couple of months, we then invited them to complete online, and they had a telephone mop-up. So all sample members could conceivably be interviewed either face-to-face, online, or by telephone. So when we suspended the face-to-face interviewing in mid-March, we already had the CAPI script, but we also had a web version of the interview and a telephone version of the script. So we were able to make change very quickly. All those people who were already active in the sample, so they had already been issued to interviewers, we sent them an additional letter and we notified them. We said the interviewer won't be visiting, and we sort of explained why they wouldn't be visiting. And we gave them a link and a password so they could complete their interview online. And we told them that if they weren't able to complete online, an interviewer would telephone them. So interviewers switched to their telephone script and then started to follow up web non-responders. And the first telephone interview sort of happened the day after face-to-face fieldwork had been suspended. And then from the April sample, so the sample that was issued at the beginning of April, we issued everyone web first. So those people who had been in the face-to-face ring-fence sample and those people who had been in the low propensity web households, we still issued them all web first. And they were sent an invitation letter and an email with their login details. They could go online, or they could click through the email and do their interview online. And then those who didn't take part in the first 5 weeks online were then allocated their telephone interviewers who then tried to contact them. So we had a fairly seamless transition in data collection because we had these multiple modes available, and the fieldwork agencies were very responsive and they were agile and they were able to switch very quickly to allocating to interviewers to work on the telephone. We did make some more changes during the summer after the initial rush to get everything ready for the transition. We added a new introduction to the survey because we were getting a few people who were contacting our helpline because they weren't quite sure how to answer and they wanted to try and help us out. So they wanted to know whether or not they ought to answer as if life was back to normal and they were doing what they were doing, or if they should talk about how it is now. And so we added an introduction to the survey where we asked them to answer according to their circumstances now, even if they're not normal. And then we added additional response options in particular questions. So we asked about furlough as one of the employment activities, and we asked about self-employment income support scheme and things like that. And then we added an additional COVID-19 module where we just asked about symptoms, if they'd had any tests or results, if they were shielding. These were rolled out sort of towards the end of the summer, and so it affects the last 2 quarters of wave 11 and wave 12 from quarter 3 onwards. And then the beginning of this year, we're adding another set of COVID questions for wave 12 year 2. So we've added some additional questions for wave 13, and we wanted to collect those for wave 12 as well. So for wave 12 year 2, we're collecting additional COVID data. And that data will be available to researchers either at the end of 2021 for the wave 11 data or the end of 2022 for the wave 12 data. So obviously, sort of replacing face-to-face with telephone has had an effect on response rates, and we have seen a decline in response. We have to remember that 30% of the sample are being invited to complete online for the first time ever. So they've normally been contacted by an interviewer face-to-face, but now they're being asked to take part online. And this includes that 10% of the sample who we knew had the lowest propensity to complete online. It's also a relatively long interview for a telephone survey. It's about sort of 40 to 45 minutes, and it's a bit longer now. We keep adding these additional COVID-19 modules. So it's quite long, and it can be quite arduous for a long telephone interview. And despite the fact that we interview people every year, we ask them for contact details every year, for some people we don't have working telephone number on record. So this slide isn't hugely helpful because it shows the adult re-interview rates for the general population sample. And we do tend to get sort of high re-interview rates. This next slide, it's the same, but it truncates the scale on that left-hand side, so you can see a bit more of the variation. And we've found that our response rates, with the grey line being the wave 11 year 1 average, so what we were getting mostly in 2019, it did dip sort of in the May, June, July months. From August onwards, these are predicted re-interview rates because they're still all in the field. Wave 12 was doing a bit better than wave 11, so we do see a sort of wave on wave increase in the re-interview rate, but we do see a sort of dip of between 5 and 8-9% on the general population sample. And similarly with the British Household Panel Survey, we saw a dip after sort of March, April, when we stopped the face-to-face interviewing, but it slowly started to creep up again. And then for the ethnic minority boost, again, it's a slightly larger gap here, sort of more like 5 to 10 percentage points. The ethnic minority boost sample on a monthly basis is relatively small, so the response rates on a monthly level do jump around quite a lot. So I've just summarized these into the quarters. And the same with the immigrant and ethnic minority boost. So this is a slightly newer sample, so it does get lower response rates, and it's also sort of harder to reach sample. So overall, we have seen a slight decline in response rates of around 3 to 4 percentage points for the general population sample in the British Household Panel, slightly more for the ethnic minority boosts. But looking at the number of interviews for the April to June 2020 samples, we have about 92.5% of the interviews that we had in the same sample 1 year earlier. So we do expect to lose some because of attrition, but we hope that we have tried to keep that as much to the minimum as we can. But obviously, one thing that has changed a lot is the mode that interviews are being done. So during 2019, about 63.5% of all interviews were done online, about 36% were done face-to-face, and there's just a tiny sliver which were done by telephone, less than 1%. Now in 2020, this is the April to June sample, just over 4/5 are done online, and just under 1/5 are done by telephone. Obviously, that's a big changed, and there's still some things that we need to analyze. So sort of towards the beginning of this year, we got the data for this quarter back, and we're starting work on analysis for this. So we're looking at things like mode effects. What are the effects of selection? We have more people now doing it online and doing it online for the first time, and we have people selecting into telephone because they can't do it online. What are the effects of the mode on the way that people answer? And in terms of measurement as well, Understanding Society is mostly a factual survey. It doesn't have a large amount of attitudinal questions, which is where we might be more inclined to see sort of measurement effects. But there are potential measurement effects, social desirability and so on. And I know that people have been doing work on this sort of analysis. So Alex Cernat has done some analysis using earlier waves of the innovation panel, which used telephone. It's also, we need to think about the impact on the return to face-to-face. So we had this 20% ring-fenced face-to-face sample, and the idea was that they would stay face-to-face, but obviously for at least a year, they haven't been face-to-face. We've been inviting them to take part online. So what happens once we resume face-to-face? Are we going to try and push these people back to face-to-face, or are we going to give them a choice face-to-face or online? These are things that we do need to start thinking about in the next few months. And there's also another effect of the drop of face-to-face, which is missing consent to data linkage. So we do ask for people's consent to link their survey responses to admin data. And we know that there is a mode effect with this. So we know that we get about a 20 percentage point lower consent rate online than we do face-to-face. This could be the effect of the interviewer being there in person, artificially inflating the consent rate because people feel more obliged to consent, or it may be that web is sort of artificially suppressing the consent rate because perhaps people don't read it as carefully, or they just answer more from the gut rather than thinking about it. But with consents, depending on who the data holder is, there is certain information that we do need to give the respondent so they can give us their informed consent. And when this is being done face-to-face, that's quite easy. There's an information leaflet that the interviewer can hand over. And for online, we include a link to a web page which has got all the information that's on the leaflet. So we can give people that information and they can make an informed choice. But it's not really feasible to do that on the telephone. These information leaflets can be sort of quite long. We try to keep them short and concise, but they do have to cover a lot of information. So it's not feasible for an interviewer to read those out over the telephone. And when fewer than 1% of interviews were being done by telephone, that wasn't really a problem. But now just under a fifth are, it means that those people aren't being asked any of these consents. So we need to think how we can catch that up once we restart face-to-face interviewing. So just thinking still about this main stage, the annual interviews, and looking forward, we are trying to do things to try and improve response, increase response. So we have been carrying out experiments on the main stage at wave 11 and wave 12 last year. And we've started to roll those out as part of wave 13. So we experimented with the use of SMS invites and reminders that remind people to complete the web survey. So before this, people were invited to take part online, initially with a letter and with an email, and then they had an email reminder. But we're starting to use SMS invites and reminders to sort of try and encourage people to take part on the web. And we're rolling these out now for wave 13 for people who had taken part in the previous year. As part of our experiments, we found that people who hadn't taken part the previous year were less likely to respond if we used SMS to try and remind them. So we're only rolling this out now for people who took part the previous year. And we've also tested increasing our incentive to £20. So from the beginning of Understanding Society in 2009, the basic adult incentive for participation was £10. And actually that dates back to wave 15 of the British Household Panel Survey in 2005, where it was increased from £8 to £10. So it's been £10 for 15 years. And so we're increasing that now to £20 after experimenting about the best way of doing this on wave 12. And so that's being rolled out now from wave 13. So we're hoping that that will also go some way to improve response. We're also looking at the way that we give people the incentives. So up to now, we've been using Love to Shop gift cards, and they are becoming less useful, partly because people really aren't going out and shopping like they used to. And secondly, because a lot of the shops on the high street that they're valid for are no longer in business. So we do have to find alternative ways. So what we're doing at the moment, we're experimenting with e-vouchers. So if people get a conditional voucher, if they complete online, then they're given a choice of what sort of voucher to have. So they can still select a Love to Shop gift voucher if they want, but they can also select Amazon vouchers or Tesco or Asda. They can have a donation to charity, or they can have it paid into their PayPal account. So we're hoping that by making the incentive more useful to participants, it's something they'll value more and they'll be more willing to take part. So these are the sorts of things we're doing to try and increase response from the participant side. But we're also working with Kantar and with NatCen to improve ways of engaging interviewers to do these telephone surveys. So a mixed mode survey can be quite difficult for interviewers because, you know, perhaps the feeling is a lot of the easier cases are done online and interviewers are left with the harder cases. So we're working with the fieldwork agencies, talking to interviewers and trying to find ways to improve the way that interviewers can do the telephone interviews. And so Kantar and NatCen have both had interviewer surveys. We've had some workshops and focus groups with interviewers, and we'll be sort of meeting later this month to then think about what we can do to try and improve our phone response. But we've also been doing other things, so reviewing other push to web designs. So Kantar's address-based online surveying, and also the ESS experiments in mixed mode surveys over the winter. And I saw actually, I think it's March the 31st, I think there's going to be a seminar in this slot about those ESS experiments, which I will certainly be signing up for. But also we're working with Kantar and with NatCen to gauge when and how best to reintroduce interviewers to the doorstep. So obviously this isn't just our choice, there's also government guidelines, there's the Market Research Society guidelines, there's SRA, and also ethics committees also have guidelines about face-to-face interviewing at the moment. But we also want to do it when interviewers feel comfortable, and importantly, when we think participants will think that this is an acceptable thing to do. So, you know, how best to reintroduce interviews on the doorstep, not necessarily just to do it a face-to-face interview, but they could perhaps be used to encourage people to take part online, make appointments for a phone interview, even make appointments for a video interview. But having that sort of interviewer personal contact, knock on the door, take a step back and interact with the sample member and try and encourage them to take part. But we are aware that a survey like Understanding Society is likely to be relatively late to return to face-to-face in-home interviewing because it is quite a long survey and we do try and interview everyone in the household. You know, we're looking at interviews perhaps spending 2 or 3 hours in a home face-to-face with people, and it's likely that there's other types of surveys that will be able to be reintroduced to face-to-face interviewing a lot quicker. Understanding Society isn't really something you can do on the doorstep. It's got to be done in home, and so this does give us some constraints. But we are sort of continually working with our fieldwork agencies to see how and when we can make best use of interviews. I'll talk a little bit about some of the opportunities for data collection with the COVID-19 pandemic. And this builds on work we've been doing anyway, because for a while we'd wished that we could send out questions by SMS to our sample. Where there were referendums or general elections, we thought it'd be really good if we could send people a text saying, how did you vote? But more broadly, we've always thought it would be good to get better data about life events, so to collect information during the year. So we have these annual interviews, and at the annual interview, we say, last time we interviewed you, you were doing this job, is that the same? We ask them about any changes in their marital status, if they've had any children, if they've moved house, if they've had any education, training or employment changes. We ask that at the annual interview, but we know that there may be some spells which are forgotten. So if someone has a 2-week spell of unemployment and then we are interviewing them 9 months later, they may forget about that. So we wanted to see if we could collect data during the year closer to the time that events happen. And also collect information that can't be collected very well retrospectively. So if someone does lose a job, we'd like to ask them about their expectations. What plans do they have? What impact does it have on their sort of mental well-being, in the short term? What sort of impact on resources? How are they coping? And these are things, again, if it's just a 2 or 3 week spell of unemployment, that if we interview them 9 months later, they won't be able to tell us about that. So if we can actually interview them closer to the point that these events happen, we'll be able to collect better information, but also new information. And we have been referring to this as event-triggered data collection. So we've been working on this for a couple of years. Kantar did some qualitative research for us with our Understanding Society participants, looking at, what would they be willing to do in terms of this event-triggered data collection, under what conditions, how often would they be willing to take part, how long would they be willing to take part in particular interviews, what sort of messaging would be useful for them. And then we used the NatCen panel to do some experimental testing, testing different ways of inviting people to a monthly survey, wording the questions different ways. We've also carried out some experiments on our own innovation panel. So we always ask people to give us their contact details, but we had an experiment to try and prioritize mobile phone numbers because we thought that would be more important than being able to send people SMS messages. And also an experiment to try and ask people if we could send them a question by SMS. Because at the moment we have people's mobile phone numbers and we can use that to contact people to invite them to a survey, but we can't use those to actually collect data. So what we'd ideally like to do is be able to send people an SMS, did you vote in the election? If so, how? And they can just respond to that. We've also done a lot of work consultation on content. So what is it that researchers want to know? So if someone loses a job, what is it that labour market economists want to know? What sort of questions should we be asking them as a follow-up? And this culminated in a monthly life events experiment that we've been running on our innovation panel sample, which was implemented by Ipsos Mori. So we sent them a pre-notification letter to tell them all about it. And then on the 1st of every month, we send them an SMS and an email, and we're saying, please take part in this life events survey. And it's a link through to a web survey. And the first question is, did you experience any of the following during the last calendar month? So on the 1st of February, we asked, did you experience any of these during January 2020? And there's a list of half a dozen or so events, things like moving house, changing job, becoming pregnant, change in marital status. And if people said yes, then there were short sort of follow-up questions about those events. And if no, that was the end of the survey. And so we've been running that monthly since the 1st of Feb. So when face-to-face fieldwork was suspended because of the COVID-19, this coincided with a time when there was a huge increase in the interest in getting data. Now, this was obviously something that was very significant to people. It affected all manner, all areas of people's lives. So there's a huge amount of data to capture these significant changes. So that's why we wanted to introduce a COVID-19 study. An advantage of longitudinal surveys like Understanding Society and like the birth cohorts is that researchers can draw on information we've collected in the past to examine how people are affected now. And also because we hope to be interviewing these people for years to come, we can also link what's happening now to outcomes in the future. Now, so this is obviously something that's very important, of great interest. For example, what will be the educational outcomes and the employment status of those children whose education has been disrupted in the last year or so. Also, because we're a household survey, we're able to link the experiences of all the household members together. So we can see how, if one person is furloughed, how that affects other people in the household. Also, because a significant part of the study was already online, 4/5 of people already doing it online, so that so the measurement difference is less of an issue than it would be for studies which are switching from entirely face-to-face to an online survey. And we're able to build COVID-19 on the infrastructure that we'd already built with Ipsos Mori on this event-triggered data collection, which meant that we could implement this and we could turn it around quite rapidly. So 23rd of March, the government issued its stay-at-home guidance. Face-to-face interviewing had actually finished 1 week earlier than that. And then in the middle of April, we sent out 42,000 pre-notification letters to all the active adult sample members. So these were people who hadn't adamantly refused and they were still active as part of the sample. And it's introduced the survey. It said, we're going to be starting this COVID-19 survey. And we also checked on their contact details. So we said, the information we hold about you is, we had an email address and SMS with their mobile phone number, but it was hatched. So, it was just the last 4 characters of the phone number and just the beginning part of the email address. And we encouraged people where the contact details were out of date or where they were missing to go onto our website and use a contact form to update their contact details. And then 1 week later, on the 24th of April, we launched the first wave of the UKHLS COVID-19 study. And fieldwork was limited to 1 week. This was because we wanted to collect the data in a fairly tight period of time. We knew that we were going to be doing this monthly at first, so we wanted to be able to collect the data, receive it, and then turn it around to feed forward some information for the next monthly survey. We also didn't want people's responses to be spread over too much time, because obviously things were happening fairly quickly in terms of lockdowns. We wanted mostly, as far as we can, everyone answering the survey, experiencing the same external environment. And we got just under 50% response rate of those who had taken part in the previous annual wave. And then at the end of May, the data were released by the UK Data Archive. And so we'd clean the data, weights had been created, we derived variables, we had a user guide and data documentation. And so that shows really the benefit of this sort of monthly COVID-19 survey, where we could go from coming up with a questionnaire to the data being released in just a couple of months, compared to 4 years on the annual interview. And as an earlier slide showed, these new modules that we're adding into Wave 11 and Wave 12, people aren't going to be able to get the data until the end of this year or the end of next. But with the COVID survey, we're able to respond much more rapidly and get the data out to users quickly. And this funding for this data collection is from the ESRC and the Health Foundation. So the study itself, it's a 20-minute survey, invitations by SMS, email, and post. We send a letter to people for whom we don't have a mobile phone number or an email address. And then there are reminders, just email and SMS on days 2, 3, and 6. We have a £2 conditional incentive. And at the end of each survey, they can either cash it in or they can roll it over to the next survey. or they can choose to donate it to charity. And we've had web surveys. So the main spine of the COVID-19 study are these regular web surveys implemented by Ipsos Mori. And these were done in April, May, June, and July. And then we went to every 2 months, so September, November, January, and we're planning the March one at the moment. But we know that people who respond to web surveys aren't representative of the population. And this was something that we were worried about. So for 2 of these months, in May and November, so 6 months apart, we also had telephone surveys, and these were done by Kantar. And the sample for this were those who didn't respond to the April web survey, and they lived in a household where there was no one who was a regular web user. So these respondents to the telephone survey tended to be older, on average about 20 years older than those in the web sample. They tend to have more health problems. There was a higher proportion of ethnic minorities. And so we think that these telephone surveys were useful to improve the representativeness of the study. And then because we're a whole age range survey, we have youth surveys, so 10 to 15-year-olds. We sent them the strength and difficulties questionnaire in July, and we're planning one for March as well. And then a full self-completion booklet in November. So that's about 50 or 60 questions, and that was done by Kantar. So we limited to 20 minutes because we don't want this to be a very long and arduous survey. Initially, we discussed the content with our topic champions, so they're part of our scientific committee, and they're sort of experts in their field of research, both within and external to ISA. And then after that, we had an open call for questions. So for the first 2 months, we had about 120 submissions of people wanting us to carry particular types of questions. And we were able to include about half of those so far. And subsequently, we've been calling for priorities and questions quarterly, and we're trying to incorporate those as much as we can. The core content of the questionnaire, we ask about household composition and relationships. And obviously then the core is about the coronavirus illness. So we ask people about symptoms, if they've had tests, what the results were, if they've had any contact with test and trace, whether or not they're shielding. And then starting in January, we were asking them about their vaccinations. We also ask about long-term health conditions, access to healthcare. Obviously, this is something that is also of great interest, not just what effect is COVID-19 having on people's health, but what effect is COVID-19 having on their access to other healthcare. So their ability to access different NHS community social care services, whether or not any health treatment that had been planned has been cancelled. For employment, we included some baseline questions in the first few surveys. So we were asking them what the situation was in January and Feb. We would have this information from the annual interviews, but it would take a lot longer for us to get the data from that. And we wanted to have these baseline questions at the same time as we had the rest of the survey. So for the first few months, we asked what they had been doing in January and Feb. And then each survey, we asked them about their current employment situation, things like their hours, earnings, if they're working at home. Then for financial security, again, in the first few months, we asked baseline questions, and then we're asking them about, what sort of benefits they're currently receiving. We ask about financial transfers, things like mortgage, holidays, and so on. And then loneliness and the GHQ, the mental health scale, we also ask each survey. And so about half of the survey is taken up with this core content. And then there are these rotating and occasional modules which come in and out. And these are all things that we think are likely to change fairly rapidly. And so we've been asking them a couple of times over the year. And particularly things like homeschooling and return to school has been of great interest. And we collect this at the child level, rather than just saying to parents, if you have 2 or 3 children, what are you doing about homeschooling? We actually ask about each child individually. And so we asked this in April, during the first lockdown, in September, just after they'd gone back to school, the end of November, as we're sort of heading towards the Christmas lockdown, and then in January as well. Just after we came back after Christmas, we were planning the January module in the January questionnaire, and after a week or so of planning that, the government made the decision to sort of close the schools again. And so we added a January homeschooling module. And this is, again, one of the benefits of the COVID-19 study is that that can happen. We can develop a module in a few weeks, it's out in the field. A few weeks later, we have the data back. But we ask about a lot of things that we think are perhaps likely to have changed quite a lot over this period. So I'll talk a little bit now about the response of these surveys. In April, as I say, we issued all adult sample members to the survey. And then in the next few months, we issued all of them apart from those who contacted us to opt out, who became ineligible, and that group that we transferred to the telephone. And then after the summer, we only issued those who'd taken part in any of the April to July surveys. So we're not sort of bombarding people who we think will never take part. And of course, it's only a 1 week fieldwork period compared to sort of 5.5 months on the main stage. So this is the response of the Wave 9 participants. Started off just under 50%. And then the green part of the bar is those who we didn't issue because they either opted out or they hadn't taken part in previous interviews. And we can see that the response rate has been coming down a little bit and is around now 35% of the total. And then on the right hand side there, the total number of adult participants. So we're getting it between, after the first 16,000 survey, we're getting between 12 and 13,500 respondents in each survey. I'll talk very quickly about this. There's a paper which is sort of in progress at the moment. It's been submitted about looking at non-response and selection to the COVID survey and ways of trying to prevent bias and then trying to adjust for bias. So using the weight and then evaluating what effect those weights have. We have these sort of three partly overlapping groups. So there's the people who we invite to web. Some of those are regular web users, some of them are non-regular web users, and then there are those who didn't respond to the web and we issue them to telephone. And we can have a look at how our weights deal with those groups. And just to summarize, we find that there is selection into the web survey. The use of the telephone follow-up does increase quality compared to just using web only. It reduces the variability of the weight, so it improves precision. And because we have to trim the weights less, it also reduces bias. Inviting the non-regular web users doesn't actually increase much quality. It does reduce precision. And we found that doing our inverse probability weights, that was more effective than using calibration weights based on demographics. And there's a sort of citation there, but it's submitted, but hasn't yet been accepted for publication. So just to wrap up, I'll just talk a bit about the data. The data is available from the UK Data Archive under the ID of 8644. And the data that's there now includes April, May, June, July, September, November web surveys, includes both the telephone surveys we've had in the July Youth SDQ survey. We've also put together a 2019 pre-pandemic sort of baseline data set, which combines Wave 10 Year 2 and Wave 11 Year 1 for those people who are part of the COVID survey. So we can also allow some of this longitudinal analysis. And at the end of March, there'll be another data release under the same ID number, which will include the January web survey and the November Youth. There's also various different types of special license that you can link to lower super upper areas, local authorities, and also for schools, if you ask people for their school users. There are over 1,000 unique users of the COVID data set, almost 1,300 unique project numbers, and mostly from the UK, but they are from other countries as well. Mostly academic users, but also third sector and government. And the data is being used by a wide range of people for different research purposes. And there's information there about to get more information about those publications. We're also trying to make the data easier to use with training videos. We're working with Patrick Valence as part of the National Core Studies Programme. So we're looking at the moment about whether or not we can linked to health data, and we may be looking at asking our COVID survey sample members to do antibody tests. So that's something that's planned at the moment and may go ahead. And there are other household panel surveys which are conducting these COVID surveys. And so we're part of this CNEF collaboration to create a harmonized file. So this is the website, the Understanding Society website, where you can get more information about COVID survey, including latest news, latest publications, and so on. Links to the data, links to the questionnaires, anything you need to know, you'll be able to get from there.